Yeah, I mean, how would how do you advocate to, like, what are the first couple steps when let's say you've won people over who hold the power to change something, on the notion that a group of black and brown kids or families in a particular area, they're poor health care, and then you've linked it to um, being 30 miles away from any kind of grocery store slash none of them are able to work above minimum wage jobs or don't have access to a car. How do you, like, what are your initial steps in attacking that systemic issue or those multiple systemic issues and maybe explain it to uh, an average person's perspective? Because I think even if somebody that cares would hear that and be like, what am I going to do? How am I going to fix minimum wage and the transit system, and how am I going to, erect a grocery store closer to these people? Like, what can be done about that? Like, if you've actually convinced somebody that, oh, okay, I see how the quality of these people's lives is not just about going to doctor's appointments, but it's all these different factors. Because to be fair, like, I think a lot of people would hear this, like, this litany of issues and think, what am I going to do about this?
Right.
Yeah.
Right. Well, honestly, there are days I'm like, it's overwhelming. It really
Mm,
is. So like
yeah.
I wake up thinking, oh my gosh, what am I gonna do?
Hmm.
But I would just say to at least start with look beyond individual stories and start looking at patterns, right? Just start looking at patterns. When Black women with graduate degrees face higher maternal mortality rates than white women with a high school diploma, that's not
Mm,
Black women failing to care for their health while they're pregnant.
that's
It's
good.
evidence of systemic failure.
Mm,
And so skepticism comes from narratives that minimize or deny racism's impact. But those health outcomes don't lie. These disparities are measurable, they've been documented, and they've been persistent over time.
mm.
So there's a bigger conversation I know right now around data and truth
Yeah.
and intentional misinformation. So
Hmm.
we've got to be actively, proactively shifting the narrative so that the public understands why these disparities exist and what can be done about them, and who the people are and organizations to support alongside us. For anyone that's even just interested in thinking about narratives or stories, one of the most powerful talks I've ever heard was when the Nigerian novelist Chimamanda Adichie's TED Talk in 2009 was titled The Danger of a Single Story. It was a
Mm,
powerful and beautiful talk where she talked about her own personal journey when she heard about a single story. And she actually started the talk by saying she heard a single story about Mexican people. And that was all that shaped her belief about what Mexican people are and are not. And what she warns us about in her talk is that when we stick to a single story about a person or a country, we risk a critical misunderstanding of people
mm,
that can lead to fear and resentment and violence that we've seen.
yeah.
So where we can even start with a conversation with someone that you've never spoken to.
Yeah.
On as much as I can, I work at home, but I go out and I talk to, the local bodega owner. I talk to the cab driver. I talk to the teacher who is teaching my 4-year-old nephew. So there are ways where you begin to understand what others' experiences are. And that then helps to inform and shape, like, wow, I thought X, but really what I'm hearing is Y. It's
Mm,
not the truth in what I'm hearing from people.
yeah.
And so we've got to break out of this isolation that we've been in and start connecting with people again.